ಇವಾಗ ಆಲ್ತ ಮಂಜುಟ್ಟಿ ನೋಡ್ಕೊಳಪ್ಪ ನಾನು ಸೆಷನ್ ಜಾಯ್ನ್ ಆಗ್ತಿದ್ದೆ.
ಇದ್ರೆ ಪರ್ಫೆಕ್ಟ್ ಆಗಿ ಬಂದ್ಬಿಡೋದು.
Good evening, everyone. Hope I'm audible.
Yes, sir, you're audible.
Thank you. Hi, I'm Shiv Prasad, co-founder and executive director of Disciples Corporate School, and I'll be your host for the day. I heartily welcome you all for Disciples India Learning Forum. Let us experience the joy of learning. Request you to kindly mute your phone, possibly sit in a place where you are not disturbed. Request to ask questions at the end of the session. Remember, a new learning is always difficult initially, but becomes a habit eventually. Today's agenda: welcome and introduction, journey to Disciples India, guest speakers introduction, and the session. So about Disciples India Learning Forum. Disciples India Group Bangalore is happy to present a platform purely for the joy of learning. It is envisaged to be an exciting learning platform where like-minded individuals and organizations can come together, share experiences and learn, and grow as individuals and professionals as organizations. The objectives of the forum are to provide a platform to share and exchange ideas and experiences, to share and develop personal and professional network of leaders or learners, to enhance effective communication and leadership skills, to foster learning and contribute for personal, professional, and organizational development, to update with life management skills and contribute as an effective member of the society. Disciples India Learning Forum organizing committee members are Dr. A.M. Suresh, Forum Advisor, Dr. B. Rupashri Tantri, President, Mr. Shiv Prasad K.M., Vice President, Mrs. Madhumati L, Secretary, Mrs. Veeraja R, Joint Secretary, Mr. Akhilesh Yannan, Assistant Secretary, and Mr. Dilip AP, Executive Member. So as of now, we have completed 123 learning sessions from last 5 years. And some of our previous learning sessions were done by Srimati Sadhana Pote, KS, on employment market and career opportunities for graduates. On Republic Day, we had Colonel Gopal Kaushik. And 105th learning sessions we had on nutrition and lifestyle. 106th on memory management for peak performance at work and study. 107th on psychological insights for holistic well-being. 108th we had Dr. Gopal Krishna on importance of accreditation and ranking of institutions in NEP 2020. At the election time, we had on responsibilities of voters and election overview. And we had habits of savings and investment. So we also had a topic on ChatGPT. We had a program on wellness through Sajjan Yog meditation. We had a partnered program with IELTS with IDP IELTS on English language international test orientation for abroad studies. We also had a topic on achieving happiness through spirituality. So we had Dr. Kavita on pain assessment. We had Happiness Reloaded by Dr. Shivkumar. We had a topic on Indian heritage and modern management by Dr. N. Sandhya. We had a topic from Dr. Chaitanya on investment planning for retirement. We also had a topic on 3 secrets for sustained success by Sri KRV Hari. On 120th learning session, we had topic on impact of CSR in government higher education. 121st, we had importance of results and success in life. And 122nd, analysis of heart sound using AI techniques to detect heart diseases. And the last session, 123rd session, was on soft skills and non-verbal communication by Dr. Naveen Kumar HC. So today I'm really happy to welcome you all for the 124th learning session. This is in association with BGS College of Engineering and Technology, Mahalakshmipuram, Bengaluru. The topic of the day is National Digital Health Mission. Our guest speaker is Professor Rajendra Hegde. Now I request Dr. Rupashri Tantri to welcome the speaker. Over to you, madam.
Yes, sir. Thank you. And good evening, everyone. I know the speaker of today's session, who is my good friend also, Dr. Rajendra Hegde, for almost 25 years, almost more than 25 years, since my student days at NITK Surathkal. And he is a very intelligent, hardworking, and a very friendly personality, and is an excellent speaker. And it's my privilege to introduce him to all of you. Dr. Rajendra Hegde has dual master's degree in MSc Physics and MTech in Systems Analysis and Computer Applications from NITK Surathkal, which he did through GATE Scholarship. He has obtained his PhD in Computer Science and Engineering from MGR University. He has more than 26 years of teaching experience in various capacities and has also worked as systems analyst and has undertaken many project consultancies of Government of Karnataka and IIT Hyderabad. He has also set up 5G labs at IIIT Dharwad, and it is funded by Government of India. His areas of interests are cryptography and network security, blockchain, computer networks, information-centric network, and of course AI and ML. He has published several research papers in reputed journals and book chapters. He is a member of many professional bodies and also holds several positions. He is a senior member of IEEE, and he was the executive committee member of IEEE CS Bangalore chapter in 2021. He is a member of CRSI, CSI, that is Computer Society of India, and Indian Society for Technical Education. Currently, he is working as Associate Professor in the Department of Data Science and Intelligent Systems, and also as Dean Academic and Student Affairs at Indian Institute of Information Technology, Dharwad. It's our privilege to have such an eminent educationist as the speaker of today's session. On behalf of Disciples India Learning Forum, I extend him a warm welcome. I welcome you, Hegde sir, and you can start the session now, sir. It's over to you.
Heartily welcome to you, sir. Sir, you're on mute.
Yeah, thank you, madam. Thank you for your kind introduction.
And I must thank you also, sir, because you are very busy now, I know, and in spite of your busy schedule, you have accepted our invitation to give the talk. Thank you very much.
Most welcome. And I'm happy to, share some information about, National Digital Health Blueprint and various initiatives by the government of India, specifically in the healthcare sector. So I thank all the team of Disciples India Learning and also BGS Institute for all attending to this talk. So I will stop the video. I'll share my screen so that we can have efficient use of the bandwidth. Okay. Can I share the screen, sir?
Yes, sir, you can share the screen.
I'm not getting the option of sharing the screen.
Hello, sir. Have given access as the admin.
I got it. Got it.
Yes, sir.
I hope screen is visible.
Yes, sir, it's visible.
Wonderful. Good evening to all. It's been almost a year. This topic I have selected for one of the FDP program, and some of the points which I may have to recollect in between. So I'll be referring to notes which I preferred. So in between, you may feel a slight delay in the topic to be discussed. So I have chosen the National Digital Health Blueprint. The government of India came up with its 2020 version. Has specifically the framework is discussed in this National Digital Health Blueprint. How effectively and efficiently can the healthcare system work using the information and communication technology? We all know that the information and communication technology has been evolving over the time, and it is growing so fast, and so much of new technologies are coming up. Now, this National Digital Health Blueprint gives guideline how our healthcare system can be integrated with the changing environment of technology to deliver effectively, efficiently, and more convenient way of healthcare to all, at all, for everyone at all age, reaching to the most lowest level of the our society, right? Effectively, that's what the main objective of National Digital Health Blueprint. So I'll go on, telling some of the points here. So today's agenda is to understand national health policy, the government of India set up a team to come up with the national health policy in 2017. We will discuss in brief of national health policy, and we also learn the federated architecture, which is specified in the outcome of national health policy team, which came up with the national health digital blueprint. And standards and regulations, these are a very important aspect of any field if you take in that manner, but it plays a very important role in the case of healthcare system. How it has to be effectively handled, how government of India thinks that whether we really have to be in line with the universal standards, or we should have any additional thing which suits our requirements. And we also will discuss the National Digital Health Mission action plans. So it's not just recommending a federated architecture to have a better healthcare system, but also the National Health Policy 2017 recommends a certain action plan for the implementation of this effective implementation of the proposed system. And we will also discuss certain conclusions that we have derived out of this discussion, we can say that. So the national health policy, which which provides us the robust framework for achieving health for all, through the adoption of basic principles like accessibility, quality of healthcare, affordability, that's the most important the thing, and leveraging the it also have the effective implementation of power of information and communication technology to strengthen the healthcare delivery system. That's the main objective of coming up with the national health policy. So some of the landmark decisions made by the governments, like if I can take Ayushman Bharat scheme, which is operating through such a robust framework IT system, which allows us to have cashless, paperless services covering more than 500 million people population, and which can implement certain healthcare schemes. There are many which I will show you in one of the slides. Yes, so it's basically integration of various efforts in the ecosystem of the healthcare system. Also having a holistic approach to achieve the goals that are defined in the national health policy. So Government of India initiated the various effort in establishing the comprehensive, nationwide, integrated digital healthcare system, ecosystem, we can say, through architectural framework, namely the one what we are going to discuss today, National Digital Health Blueprint. So let us understand these things, National Digital Health Blueprint, in detail. So the goal of this National Digital Health Blueprint is to achieve the highest level of health and well-being for all at all ages, through increasing access, improving the quality, lowering the cost of the healthcare. This is a basic key principle, you can say, in NHP 2017 National Health Policy, which includes universality, citizen-centric, quality of care, and accountability, of performance. These all are effectively need to be implemented in the system. So what is the need of the hour here in this national healthcare system? Is deploying the technology for healthcare and continuously and widespread, with the benefits have been to reach out to the fragmented lowest level of the our society. So citizens must have access to healthcare records. That's what I feel. Over the study I have seen that we as a users of the system, for example, I am being the patient, I have lot of records, healthcare records being generated. Pardon? Yeah, so there are a lot of healthcare records are being generated, but hardly we have access to these records. That's one of the drawback of the existing system. So we need to have a integrated system which services which provides to a must provide to have a healthcare system which is more citizen centric, you can say, significantly. So so there are various the goals have been defined, some of them which I have listed out here. What we see in the absence of certain things in the current system are like data is not maintained in a standard, and there are no regulations which are defined for that. If you look at the international level, some of these countries have adopted their own systems, and they have effectively implemented such healthcare system because these systems run on standards and regulations. One such example what I can give is Canada, which has an information highway which adopted metadata standards, electronic health records, and so on. In India also, we are also slowly getting into these systems. You find government of India being implementing healthcare records as electronic healthcare records, most famously known as EHR. And is also there are various developments which are happening. CDAC is the one organization which is also contributing for standards. They have developed various APIs for metadata and data standards, MDDS standards, EHL7 standards. There are so many standards which are there in the healthcare system. So for this, the government of India constituted a committee from the healthcare ministry to implement the framework for the national health stack, NHS, that's called as, proposed by Niti Aayog, and Niti Aayog is being monitoring the activities under this National Digital Health Blueprint. So they came up with the National Digital Health Blueprint, and this has come up with a lot of feedback from the citizens, various stakeholders, citizens, healthcare systems, hospitals, various various stakeholders of healthcare system, if I can generalize this. And it's also mentioning that the federated architecture to set up the set of architectural principles, also the 5-layer architecture, which we will see very soon, and which refers to the building blocks, unique health records, UHI ID. Now it is being implemented by Government of India. And also it not only just implementation of this, it's also regulates the use of standards and healthcare analytics for all purpose. So you will find them slowly being implemented by the government of India. So let us have a look into it. So this gives the yes, just a second. Yes. Let us look at the key principles of this National Digital Health Blueprint. This is the part of National Health Policy, which was set up in the year of 2017. This comes up with the, creating a framework for evolution of National Digital Health Ecosystem, that's called as NDHE. And this is a ecosystem, not a system. It's a ecosystem. Every stakeholder is a part of the evolvement of the National Digital Health Blueprint. And this is a part of National Digital Health Mission, NHDM, the entire process which has come up with this. So there is a caption. What you can see is the think big, start small, scale fast. If you look at this, that's the main idea of implementation of healthcare system for all. So this key principle, what are the key principles? It should be citizen centric. What we see now, you go to any hospital or diagnostic center, there are many places we visit. We have hardly any system which is working for citizen centric as with respect to the data availability. I'm not talking about the hospital services. Obviously they must be citizen centric, but availability of data is a one scarcity. Where I go to hospital, I will be admitted there, the lot of data is created, but I go out of the system, this data not available to us. So it is not what you see is not citizen centric. Okay. And the quality of services, quality of care, that's an important aspect of it. Better access, universal health coverage, and inclusiveness. These are the key principles of the that is defined in the NHDM. So the task required to develop a holistic, comprehensive, and interoperable digital architecture. That's an important point which I am introducing here, which is missing at this point of time. As far as the implementation of it is concerned, Government of India and state governments are taking a very holistic approach in implementing. But when it comes to the private partners, private institutions which are involved, they are yet to be adopting this technological thing. Let us look at the layered framework, what is proposed by the NSDM in its policy vision principles. It is establishing a core digital healthcare data and infrastructure which is required for seamless exchange of information across various stakeholders, promotion and adoption of open standards, right, by all actors. This is greatly, what I have mentioned, given an example of information highway in Canada. Such a system has to be implemented in the healthcare system, in the development of multiple digital health system spanning across all sectors, from wellness to the disease management, the things, and creating healthcare records. Now the standards have come up. EHR, you visit any government hospitals, your records are recorded as electronic healthcare records. So that gives us various application of information technology, whether including availability of records to analysis of these healthcare records for better implementation of various policies by the government of India and state government. So, and there are other things like, if you take building blocks, the building blocks, there are 35 such building blocks proposed in the NHDM. Some of them very important one, the 4 of them, which I will be discussing here. Identification. What you see here, I go to one hospital, then next month I'll be there in some other city, and next again some other city. So everywhere my records are created. But what is happening now, these records are become silos in nature, right? So there is some kind of identification which is required, which has to be a part of it. That is UHID. Government of India has introduced UHID. Now we can have our records being recorded into UHID so that they are retrievable from anywhere, any location. So which gives a person's identification in terms of facilities, diseases, many other things like, through the UHID. And also health locker. Now, Government of India has introduced a health locker. And this should be having a, citizen-centric, which I explained it, like it is focus should be on giving better services to the citizens, like having consent management from the citizens, the records which are created for my health records. My health records, I should have a control over it. Now, as of now, what we look at is we don't have any control over our records anywhere. So the NHDM says that citizens should have control over the records. So through the consent management, anonymizing the the data, the better services, privacy and privacy of the data, security and privacy of the data. That's also important aspect of it. Interoperability, it means that, see, if you see that there are number of healthcare applications which are running in Government of India itself, there are so many schemes, and every scheme has its own application. What is happening is each of these applications are not talking to each other. This is because they are not following the standards and regulations. And because of these applications, of course, they are wonderful. They are serving the purpose for the reason they have been built. But what is happening is Government of India, or for that matter, any government, you can say, they cannot implement the certain, services, certain policies effectively because of the interoperability problem. Okay, so this NHDS, NHDM and NHP, they specify the interoperability standards, how these applications can speak to each other. Of course, one of the such issue is the standards and regulations. If these applications can implement standards and regulations, they can be connected very easily. Excuse me, give me a minute. Yeah. So, yes, and the healthcare, digital healthcare infrastructure that has to be provided for all stakeholders, and digital healthcare data hub. The data hub is very important. This has to be connected, interoperable, because the healthcare system produces a huge data, and this data is being accumulated over the time. Now, what is important now? How effectively we can use this data in a era of artificial intelligence and machine learning techniques and deep learning techniques what we have come up with now, so that it is useful for effective implementation of services, future services being to be implemented, and many more, like how we can predict what will be the effect of certain environmental changes in and around the country, how it is going to have an effect on healthcare system, where are the possible areas where government can look in and stakeholders can look in, so that you can provide a better healthcare to everyone. So this is a very important aspect of it. What is happening right now is data being created. This data is not available for any kind of research being done on it. Unfortunately, this was one of our project. We could not, I don't want to make it as a recorded here, but we could not get the data to have certain analysis being done on that. Yes, these are the policy issues. Probably Government of India and Government of Karnataka can do a better service to ensure that this is being done. So I'll move on to the next topic. That's on key initiatives which are being implemented by the Ministry of Health and Family Welfare. Okay, Government of India as well as Government of Karnataka. So there are various objectives which are set by the this ICT, through ICT, for the effective service delivery and citizen empowerment. So this has been being implemented to improve the efficiency in healthcare delivery, extend the healthcare to rural areas, provide better quality services at a low cost, and certain e-health initiatives like use of ICT, information communication technology. These are undertaken by Government of India and Government of Karnataka, and both that matter I'm referring to because I know Government of Karnataka initiatives because we were part of the project which we handled it. So the objective of these services are like ensure availability of services to wider scale for everyone in this system, and to address the human resource gap by efficient and optimum utilization of existing manpower in the healthcare sector, and to provide healthcare services in remote and inaccessible areas through telemedicine. One of the initiative Government of India has, Government of Karnataka has implemented it very effectively. It is being observed, and it should improve the patient safety by access to the medical records, which also help in reducing the healthcare cost. That's the most important. What we see that's missing here, because I go to hospital, we are advised to take certain tests, and after a few days I go to another hospital. There again we have to repeat the same what you can say test. I ask no, really I worry about this, like the cost of healthcare which shoots up like anything. No, the question arises, why those records are not being considered? If they are not considered because of they are not following the standards, then why the standards are not being implemented? Why a particular hospital is not being monitored for implementation of the standards? If it is followed, then why the second hospital to which I visit is not considering these records? So these question arises. These are very crucial aspect of the healthcare system. Because of this, every patient is facing a lot of problems, especially in case in the cost of healthcare, which is a great concern for every one of us. And also, the objectives continue like, monitoring geographical dispersed tasks or meaningful, field level interaction through the effective use of management information system. And also improve the efficiency and imparting the training for capability building. This is also important. Like, government of Karnataka takes care of implementation of these through the lowest level of workers. We know that I forgot the particular community who implement all the policies. So there are various key initiatives the government of India has taken it. Research to Productive Child Healthcare, RCH, and some of them, most of them, they are following now the healthcare standards. Integrated disease surveillance program, integrated health information platform, national health portal. These are all the initiative by government of India and government of Karnataka in association. Like, it's not isolated one, you can say. So yeah, now let me go to the next slide. So what is the vision of national health, the national health policy? If we look at the vision of this, I would like to read it as it is. It is to create a national digital health ecosystem. It's an ecosystem. It's not a system. Ecosystem involves everyone in the, every stakeholders in the system that supports universal health coverage in an efficient, accessible, inclusive, affordable, and timely and safe manner. Remember, these are very specific words. Through provision of a wide range of data, information, and infrastructure services, duly leveraging the open, interoperable, standard-based digital system, and ensuring the very important part, security, confidentiality, and privacy of health-related personal information. For all these things, National Digital Health Blueprint specifies the standards. Like, for example, how do I implement the security, confidentiality, and privacy of the healthcare records? So there are standards which are open standards being implemented already, are being implemented. The same standards are being specified there. Let us look at how much time I have, Madam Shiv Prasad sir. Still have half an hour. Rupashri?
Sir, I think it's 1 hour, sir.
Yeah.
Yes, sir.
I have still half an hour time?
Yes, sir.
Yeah, okay. Thank you. Thank you. So objective is to, achieve the vision of NSDM through these listed, points. It is to establish the state-of-art digital health system for managing the core digital health data and infrastructure which is required for seamless exchange of information. So we need to have such a system, which I explained in the slide 3, to establish the national and regional registries, national as well as regional registries. Notice that it should be the data should be produced and maintained at the lowest level, very close to the citizen thing. It is to create the registries and it should be single source of truth. This is a very, very important aspect of it. It means that my data record should have single source of truth. Wherever I go, the record has to be established, retrieved from this single source of truth. For this, we can use the ICT technology for the implementation of that. This singular source of truth should establish a connection between clinical establishment, healthcare professionals, healthcare workers, pharmaceuticals, or, for that matter, all stakeholders the data should be of single source of truth. And next is enforcement of adoption of open standards, right? This is slowly being implemented, and it is being specifically mentioned in the National Digital Health Blueprint, how it has to be implemented, what are the standards have to be adopted. Next is the EHR standard, electronic health records, which is based on the international standards. And this allows us to have easy accessibility to the citizens and to the healthcare professional, service providers. And this is based on, it will be based on citizen consent management. So there are adopting the best principles, inclusiveness of everyone in the system. There are many more such objectives to be achieved. I request anybody who is interested to know more can refer to the National Digital Health Blueprint, which has been released in 2020. And this document is available in a Government of India portal. Anybody can download and study it. Let us look at the key architecture of National Digital Health Blueprint, which specifies it. The core of this is the principles which are defined in the NHDM. So, sorry. Yes. This is a very NSDM. If you look at the overall, this is a very complex system, and it's very large and complex, heterogeneous system, and also very sensitive, critical at the same time, because so many stakeholders are involved, so many platforms are there, so many applications are there, so many requirements are there. So all this, considering it is a very complex system. So this requires, distinct approach, like establishment or creation of core information system, which should act on minimal basis, and promotion of set of principles and standards to be adopted in all ecosystems and by all the players in the ecosystem. So let us look at this diagram in more detail. What we have is a core principles which are defined in the blueprint, which we have discussed already. Then comes the federated, architecture with its building blocks. In the federated architecture, which we will see in the coming slides, how this architecture, how the implementation of this healthcare system should be, that is defined in the federated architecture with the building blocks. Which are the building blocks of this? This we will see in the next slide. Then comes the standards and regulations that are part of this, and applications and services that define the core and reusability in the services. Then you have institutional structure. Each institution, how it should have its own structure in line with the principles which are defined here in the healthcare domain. So we'll see all these things one by one in the coming slides. The core principles. The core principles are, defined here. This is a core principle. The first point what we are going to discuss. We require to have unique and reliable identification of persons, relations between the persons in the system, professionals and their identity. There's a doctor, nurse, or any person which is there in the professional in this system, service providers, service facilities, you know, and every player across the entire ecosystem, whoever be part of the system, they need to be identified uniquely, and there must be a reliable identification. This reliability has to be implemented there. The second one is trustworthiness of information being created by the entities in the ecosystem. It means that my records are created here. When I go to the Bangalore, the same records are available, should be accepted by that healthcare system. That is what the trustworthiness has to be built across every users of the system, every service providers of the system. The third part is capability of creation of longitudinal healthcare records in the diverse system for every individual, from information which is being held in the diverse information system. Next is the management of consent for the collection and use of personal data. That's missing now, right? So when I go to the hospital, yes, data being created, of course we give the consent, knowingly or unknowingly we give the records to be created, records to be the part of their system, and all these records are available. But unfortunately, none of us, we say that yes, you keep the records, and we assume that we also not bothered about our records are held secure and they kept private. No, I don't think every hospital has this system, right? So that's where now it has to be implemented. And more importantly, that if the records must be available to the right owner of the record. The patient is the right owner of the record, not the healthcare system. Healthcare system are the custodian of the records, but they are not the owner of the record. But the current existing system, what is happening, they are the owner of the record, and we as the users of the system, we don't have any control over the system. So it is the consent management has to be implemented. How it has to be implemented, so information technology specifies it. And there must be assurance of privacy and confidentiality of our record, and conformation to the law of land. That's a very important point which is mentioned in the National Digital Health Blueprint. And adopting to the principles of the government of India in its national health policy, which has been defined. So next is that federated architecture, which has architecture which is allows interoperability. That's like every what I told you. I go to one hospital, then another hospital. There is absolutely no communication. This architecture specifies how we can integrate the data, right? But in a government level, it is being implemented very rigorously, and the most of the applications now are being connected. Data are available. I go anywhere in India, of course, anywhere in India, I can have my records available there. But unfortunately, most of us don't visit to the government hospitals. Our records are not available there, or the records are very minimal in nature. So yes, the key principles of this federated architecture are it should be the healthcare data and applications are held at 3 level of architecture. This is a 3 level which is mentioned here: a national level, state level, and facility level, right? What you see in the bottom most, it's a national level, middle layer is a state level, then top layer is the local layer. And of course, the citizens have access to all these records through various applications like My Health app, Health Portal, Health Locker, PHR, that is called as PHR, and you have value-added services. Many services are which are available there. Right? Patient comes on the top of all these things. So patient data held at the point of care or at the closest possible location. So if you see that this local level that is very close to the patient, right? All the applications which are healthcare applications which are running there, and technology and building blocks are implemented there, which includes anonymization of the data, consent management, telemedicine services, office tools, various things, applications which are running, data being implemented in the as a record, like healthcare EMR record, electronic management records, diagnostic records, many records which are held there, which includes the IT infrastructure to store and provide the access to the records. The same level you will get here with a little changes in the state level and the national level through the federated architecture. So this is a federated architecture which is being recommended in the NHDM. So this architecture is 3 level, which I explained it here already. Each layer has a 4 layer each, consisting of set of building blocks, each building block at each layer across the 4 layer, and 3 layers are loosely coupled to the need to content basis file, like using standards of APIs to implement them. And the principle of minimality is adopted in each layer, and the design of the building blocks. It's a minimality. It means that what is the minimum records and minimum implementation of services in each layer of it, national level, state level, and local level. If you look at the national level, most of the records which are available are aggregated data of the national. Like, for example, how many COVID cases have been observed today, right? How many children birth has been notified today. So these are all aggregated data, and similar aggregated data in the state level. But when it comes to the local level, all information must be available. So where exactly the childbirth has taken place, who is the mother, who is the father, what are their records, what is the health of the child which is born today, whether it's a malnutrition case or it's a healthy, all these information should be available at the local record. So this is what the federated architecture, why it is required to have it, because every state need to be implement certain services, right? Whether it is to have effective healthcare system or to have a specific policies to be implemented, the state should know these records. And similarly, national level also. National level, like, government of India wants to take up certain like polio eradication. So it should know where exactly the polio cases are being generated, where these polio cases are coming up. Is it localized or it is across India? So that kind of information should be available, because these kind of the policies has to be established and implemented by the central government. So that aggregated data record should be available in the national level. So this is how the federated architecture has been specified in the National Digital Health Blueprint. Okay, so I'll go to the next slide. There are a few more slides which we'll see. Standards and regulation. This is very important point which I need to mention it here. Sorry. Let me look at my notes also. I need to view this. Almost a year which delivered this talk, some of the points objective is, yes, standards and regulations. I keep on telling that this is where it is required for many, that scope defines why we need to have it. So objective is to adoption of implementation of standards in the healthcare domain. So healthcare domain is a very wide services, and there are so many stakeholders, right? What we can visualize is a very few of us can visualize them. There's delivery of drugs, drug creation, logistic delivery. That's a one area. Doctors, hospitals, patients, diagnostic centers. So many facilities are there, and so many people who are the part of this healthcare system. So this is a very complex system. So all these things must be implemented in a standard way. Otherwise, it becomes very difficult for any kind of data interoperability, porting the data from one system to another system, right? And moreover, this system what we have is a very heterogeneous system. Everyone is using their own information system technologies. Applications are running various platforms, various applications. You will see that there are many applications. Mobile applications are running. Okay. Excuse me.
Participants, please mute your phone.
Okay. And multiple level environment that exists across the country through multi approach, also through effort of many actors that needs to be in sync, right? For that we require to have standards. So what is the objective here, which is defined here, is use of standards required for ensuring the interoperability. Okay. Now, there's a consent management. Like, look at the consent management, which I was mentioning, that every ecosystem user must have a consent to be obtained from the data owner. That's a patient who is the data owner of the system, right? And for both collection of the data as well as use of the data through the this is where it is defined in the NSDS. And privacy and security. Now, we all know that this data is being created, and you go to every hospital, whoever visits there, the data is being created. My healthcare data is being created. Now, what is the threat? What we have is the misuse of this data. You might notice that recently AIIMS Delhi was attacked, and the entire information system was not available for many days, 3 to 4 days. The data was logged. We don't know whether data was stolen or it was just hacked, and the system was not available for the users, legitimate users. But what is the outcome of it? There is every threat that the data is being captured, and we all know that the AIIMS has all high-profile visitors of that hospital. Obviously, it is a great threat to not only to the individuals but also to the country, our country itself. So it becomes very important that how the organization maintains the privacy and security of the data, because for every user, their data is very important. There is the misuse of data can happen anytime, right? So there are standards which are defined how data has to be stored, right? There are technologies like it should be encrypted. The hashing technology has to be used whenever there is a transportation of the data or flow of data. It has to use certain standards. through reliable data transfer, secured reliable data transfer. All these things are defined in the National Digital Health Blueprint. So exact implementation of it, because I am telling you, because we are all in the part of it, like I'm being the part of computer science individual, I should know how this data is maintained securely. Right? Of course, Government of India has defined it and they are trying to maintain it. But when it comes to the smaller silos institutions like a small hospital here, for them it is a cost effective. It is not so important for them to have a privacy and security of the data. They think that it's all right. No, but for us as an individual, it is very important aspect of the data. Right? So patient safety and data quality, which are all part of it. Now, having done all these things, NSDM defines how do you implement this. That's an action plan which is defined in the consent, action plan. Okay, let me go to that part. I have some notes on this. Yes. Yes, it defines, action plan defines what are the purpose of NSDM, having this National Digital Health Blueprint, the scope of implementation of it, what are the expected outcome and methods. We'll see one by one. The purpose of this action plan is to seek the service of with these purposes which are listed there. It enables crystallization and define the scope and outcome of the initiatives to identify the methods to be deployed for the implementation of blueprint. So that's a scope. More precisely, if you can say that it's a health for well-being for all, health and well-being for at all ages, universal health coverage, citizen-centric services, right? Yes, and it is a prioritization of various activities also required to fulfill the vision and objectives of the establishment initiatives. It is also to establish the institutional structure. So all structure need to be there implemented. It's a data center, security of the data, implementation of standards, all these things. So that it gives establishment institutional structures and identifies the core building blocks which are defined in the blueprint, which we discussed in already, and widespread awareness of NDHP, National Digital Health Blueprint. The part of it is what I am delivering right now. This is a part of the action plan, and the critical mass capability. You mean to say that you need to create the process which is applicable to the mass capabilities, and it should be implemented in a smooth implementation. That's a part of action plans. Let us go to the scope. Scope is, as I told, it is healthcare for well-being for all at all ages, universal health coverage. The health coverage should be available at all places, at all time, at all scenarios. Citizen-centric health services, quality care, accountability for the performance. If something goes wrong, somebody has to be accountable for that. That we don't see now, right? Efficiency and effectiveness in delivery of the services, creation of holistic and comprehensive health ecosystem. These are the scopes of implementation of NSDM. Now let us go to the expected outcome. So expected outcome is the citizens should be able to access their electronic health records in a convenient manner. I should have control over my electronic health record. All the time, health records should be available for that, right? Diagnostic test streamlining, that's what I told you. I do a test here, then I go to somewhere else, then I have to do the same test again. I have to pay a hefty fee for that. So why it is required? There's a cost. It should be cost efficient, right? And EHR aggregation of health records availability. The health records are distributed across various facilities, but the aggregated data should be always available for all the purpose. Assurance of citizens of continuum healthcare. The healthcare system should be available for the citizens all the time. Yes, voice-based outreach. This voice-based outreach can be anything. Like there can be like system should be available, where app should have because many the people across the country, they may not be well versed with the use of technology ICT. They may have a voice-based system where the interactive voice-based bots can be created for the effective use of the healthcare. And national portability of healthcare services. Yes, the healthcare records are created in Karnataka, should be available in other states also. If I go there, I should be able to access that. Privacy and security of EHR. That's a very important point. Data-driven decision making and policy analysis. So this happens at the highest level. The data are available. Decision has to be taken. What are the future plans to ensure that better healthcare for every citizen? The government has to decide on this, doing certain analysis on the data. Next is, how do you implement this plan? Yes, plan has to be implemented, right? So action plans are mentioned. It has to be implemented through the federated architecture, which we discussed, the 3 level. UHID, which gives a unique ID across India. Electronic health records, which follow the standards like MDDS, many other standards. Registries at the local level and state level. The registries should be available where we register the things, register the EHRs and all those things. Directories should be available for all this matter. And legislation on the data management. Yes, government of India and government of Karnataka, they have to come up on how to manage this data. And this data is huge data. Healthcare data is huge, but it has to be managed. Security as well as analytics, which part of it. And yes, I think we are the right time. Let me conclude the entire discussion on this. So we have discussed the federated architecture, action plans, all these things. So NHP, National Health Policy, which came up with its own the team and robust framework, and they released the National Digital Health Blueprint, which gives certain action plans for all the stakeholders to be to make sure that healthcare is available for every one of us. So this is basically adoption of basic principles of accessibility, quality, and affordability. At the same time, security and privacy of the data. Availability of electronic health records, leveraging the power of. So all this is possible with the help of using the technology. Like technology is growing fast. Like, now when it comes to the data, there's a huge data. How effectively it can use this data with all AI-powered technologies. And when it comes to the consent management, there are now technologies which are coming up, like blockchain provides you the implementation of consent management, how the records can be in control of the owner of the record, and leveraging the things. Ensure the cashless and paperless service. This is expected. We look at now how the country is growing now, the more and more towards the paperless, cashless transactions, and it is expected that this should be implemented in healthcare system also. But of course, for this matter, there will be a lot of opposition, it will be there always. And let us see how it is implemented in future. Integration of various efforts in the ecosystem in the digital healthcare. So these are all, things which are defined in National Digital Health Blueprint, which is available freely. Anybody can download, go through the system, understand. And if you are part of building such a healthcare system in your future life or any such project you are doing it, this gives a very good guideline for all of you, all of us. So with this, I conclude here. I open the discussion for any kind of questions. Over to you, madam.
Yeah, thank you very much, sir. It was indeed a wonderful session.
Yeah, thank you, madam.
Participants, you can ask your questions now. The forum is now open for questions, please. Any question? Google form has been shared in the chat box. Participants, please fill the Google form to get your e-certificate. You will receive e-certificates within 7 working days. Yes, questions, please. Madam, Manjula madam, Parvati madam.
Yes, ma'am.
Yeah, any questions?
Hello, can you hear me, ma'am?
Yes, yes.
This is Dr.
Any
Parvati,
questions?
ma'am.
Yeah, if there are no questions from the participants, I request Parvati madam, who is Associate Professor in the Department of Computer Science, to kindly give vote of thanks.
Jai Shri Gurudev. Ma'am, am I audible?
Yes, ma'am, you are audible.
If you're not willing to learn, no one can help you. If you're determined to learn, no one can stop you. Happy evening to one and all. I, Dr. Parvati C, Associate Professor, Department of CSE, BGSCT, take this privilege to propose vote of thanks and be a part of this event. First of all, I would like to thank our esteemed speaker, Dr. Rajendra Hegde, IEEE Senior Member at IIT Dharwad, and a team of Disciple India's Learning Forum on behalf of Management, Director and Principal, BGSCT. Thank you, sir, for your unwavering commitment and dedication to advancing healthcare through digital innovation. Thank you for taking us through insight of NHP 2017, which focuses on universal healthcare, emphasizing preventive and promotive healthcare services. The policy aims to achieve comprehensive healthcare, promoting digital health for all at affordable and accessible services. Thank you for walking us through the federated architecture, the digital health blueprint, which ensures privacy, security, compliance with relationship in health sector by providing patient-centric approach and also empowering patients with control over their health data, in turn contributing improved care. I also would like to express my sincere gratitude to our director, Sir GT Raju, and Principal Dr. Ravikumar GK for their visionary support and guidance, whose expertise and hard work have played a vital role in bringing up this event. Last but not the least, I would like to thank all the participants and students for their active involvement and commitment to learn. Thank you, one and all.
Thank you, madam.
Yeah.
Thank you, sir.
madam. Yeah, thank you.
Thank
and
you,
I also
ma'am.
thank BGS College of Engineering and Technology for having a tie-up with our forum. Thank you very much. And I also thank the speaker, Dr. Rajendra Hegde. Thank you so much, sir.
Yeah, thank you. Thank you, Parvati madam. Nice to see you after a long time.
Yes, sir. Yeah, happy here also, sir. Thank you so much.
Oh, great.
I was very happy when I heard about you. Thank you, sir.
Oh, okay. I was just thinking like it's a you only, but
It should be.
could not
Yeah,
be
it was me. I'm sir. Yeah. Thank you, sir. Thank you very much.
okay. Welcome.
Thank
Yeah,
you all.
thank you, sir.
Yeah, thank you all.
See
We
you.
will close the session, sir. Yeah,
Yeah, thank you.
thank you. Bye.
Bye.